Hi, I'm Dr. TEJPAL Shah, a consultant physician, MD in medicine, practicing in Kalyan with my own clinic and all the three hospitals which I am attached with. So today we are here for discussing a very important talk on secondary prevention with atorvastatin and clopidogrel combination. Again, the combinations have been there since years together, but yes, the important part is secondary prevention is usually many a times either undertreated or overtreated. So the talk will probably help you in understanding the things much more better, whether it has to be atorvastatin ecosprin or aspirin or atorvastatin clopidogrel. That's what we will be deciding in this few minutes of present talk. And I thank my Prolabs for inviting me for this talk. So, atorvastatin is an HMG CoA reductase inhibitor, and that's what it's the important part that this group has 4 or 5 molecules, right, from atorvastatin, rosuvastatin, and others. This has been quite there as in one of the initiator brand, and it has remained thereafter, and it has been approved in dyslipidemias, primary hyperlipidemias, mixed dyslipidemias, and again, it remains in first-line treatment whenever you are starting a treatment for your triglyceride patients also. And later on, if not controlled, we shift on to the other modalities. Now, secondary prevention actually gives you a lower risk of myocardial infarction, stroke, revascularization procedures, and angina in high-risk patients, including those patients of type 2 diabetes without coronary heart disease. Now, this is an important part that it actually helps us in preventing the future CAD, and that is something what we look into. We want our diabetic patients to live longer, and this is how it actually helps us. So it technically helps in reducing the events like myocardial infarction, stroke, angina, revascularization procedures, and heart failure admissions in your chronic heart disease patient. The important part was that initially it was been quite, the things were favoring aspirin with atorvastatin. And now what we are looking at is we are taking out the aspirin part and looking at focusing on atorvastatin with clopidogrel. It's an antiplatelet again, and it has been approved in unstable angina, non-STEMI, STEMI, and other with other agents. And again, the mechanism of action has been quite specific, irreversible P2Y12 ADP receptor inhibitor, and it actually helps in reducing the platelet aggregation, which is a primary event in most of your plaque rupture and events. So it has been proved in MI, stroke, peripheral vascular disease, and definitely it actually been also been very commonly used in your patients with ischemic heart disease, thromboembolism, and other carotid artery stenosis and peripheral angioplasty wherever possible, and patients with TAVI also. So the benefit is improving the blood lipid levels, improving platelet indicators, and reducing the risk of cerebral infarction and other adverse events. The clinical trial which actually took place, which was studied very comprehensively in the transient ischemic attack patients, and it was very categoric that this patient who were been there on atorvastatin calcium plus clopidogrel had a better lipid profile and antiplatelet action and gave you a better outcome overall and significantly less platelet inhibition compared to clopidogrel alone. So this was the importance why when we use this combination, your platelet aggregation also goes down and you have a better clinical outcome in most of your patients. And simultaneous usage of high dose of atorvastatin and clopidogrel does not interfere with platelet inhibition during percutaneous coronary intervention. And this is an important part because we want sometimes, many a time the patient just present in casualty and you just need to give the loading dose, and we are feared that the patients, if he undergoes an coronary event, whether it will bleed or whether it will have an adverse effect later on. But yes, it has been well studied that the simultaneous administration of high dose of atorvastatin and clopidogrel loading dose during an PCI has no significant effect on the clopidogrel platelet inhibition efficacy. So high dose of atorvastatin on the pharmacodynamic effects on the double dose clopidogrel in patients undergoing percutaneous has been a favoring effect. Now, what does the guideline recommends? A single antiplatelet therapy with clopidogrel to reduce risk of major adverse cardiovascular events in patients with symptomatic peripheral artery disease, and moderate intensity statin to be added depending upon the statin benefit groups actually gives you a better outcome. If you go forward, to understand this, the key point here is that atorvastatin, again, it lowers the cholesterol quite significantly, prevents the cardiovascular disease and overall death, and it is used as a primary prevention, secondary prevention, and also a tertiary prevention in most of your coronary artery heart disease patients. Whereas clopidogrel, an antiplatelet drug, again the P2Y inhibitor, helps in treating the unstable angina and STEMI and undergoing fibrinolytic therapies. So again, it is a cornerstone of management of all events what we look into. And if we combine them together, it actually not only improves the lipid profile by reducing the LDL cholesterol and bringing it down to less than 55 of any proven uh, any proven ASCVD patient, or at least less than 70 in most of your diabetic patient, where the goals have been set depending upon their other associated risk factors and major and minor risk factors, which the recent guidelines suggest. And also, it has a benefit in reducing the total cholesterol, the non-HDL, and with the combination, you have an enhanced platelet indicator, reduces the risk of cellular infarction and minimize the adverse reaction. So this is the importance of combining this both clopidogrel and atorvastatin again together and the atorvastatin together. Combination therapy resulted in lower TG, lower total cholesterol, lower LDL, lower LDC, LDL cholesterol levels, and through clopidogrel platelet inhibition was less effective when combined with atorvastatin, and no significant relationship with cytochrome 3A4 metabolized statin and clopidogrel response were observed very categorically, suggesting that they go really well hand in hand whenever used together. The only problem remains is very few percentage of Indian patients are clopidogrel resistant, and this is something which is rare, where you see that there is worsening of stroke in spite of use, and you should be really vigilant in understanding that this resistance do occur in a very minuscule percentage. So we can definitely shift most of our patients from the aspirin atorvastatin combination to clopidogrel atorvastatin combination, which gives you better control and a better outcome. And definitely, it has been really approved in almost across all the guidelines in managing non-STEMI, STEMI, and other atherosclerotic cardiovascular disease patients. So these are the views of mine on atorvastatin and clopidogrel. And just going to finishing off with a very important action, that it has been always told that HMG COVID reduces the cholesterol synthesis in the liver and increases the LDL receptors on the liver cell, and enhances the LDL clearance from the blood. This typical process is many a times really exaggerated in most of your familial hyperlipidemia patients. And that's why you need higher doses and early onset of atorvastatin in most of your patients with familial dyslipidemia patients also. So I hope my views on atorvastatin and clopidogrel seems to be quite clear, that they work very nicely it together. And I close my views on this right now.